The adoption of resolution condemning attack on healthcare workers and facilities has been passed at the United Nations Security Council. Recently, dozens of medical facilities have been attacked, mainly in Middle East and Africa. Among the most recent one was Syria's second city of Aleppo last Friday, damaging a clinic just days after a strike on another hospital, killing 2 doctors. Secretary General Ban Ki-moon in a statement told Council that intentional and direct attack on hospitals are war crime, noting that even wars has rules.
Intentional and direct attacks on hospitals are war crimes. Denying people access to essential health care is a serious violation of international humanitarian law. All state and non-state parties to conflict are bound by a strict obligation to respect and protect the medical personnel, facilities, and vehicles, as well as the wounded and sick. Parties to conflict must allow and facilitate rapid and unimpeded passage of impartial humanitarian relief, including medical missions. These obligations are at the very heart of international humanitarian law. Even wars have rules. It is time to uphold and enforce them.
This resolution was co-supported by 5 non-permanent members of the United Nations Security Council, namely Uruguay, Japan, Egypt, Spain, and New Zealand, representing all regions.
No government should stand by and watch the erosion of safeguards for the protection of civilians in conflict. The international community must never become numb to flagrant abuses.
Reflecting to the bombing of Doctors Without Borders Hospital by United States military late last year in Afghanistan, the president, Medicine Sans Frontier, said she truly believed that the hospital was a safe place, but could not see that anymore.
I truly believe that the hospital was a safe place. I cannot say that anymore about any medical facilities on the front lines today. In Afghanistan, the Central African Republic, South Sudan, Sudan, Syria, Ukraine, and Yemen, hospitals are routinely bombed, raided, looted, or burned to the ground.
Attacks targeting hospital and medical workers are unacceptable and will not be tolerated, were some of the words of the permanent representative of Egypt to the United Nations.
Resolution 6.2. First, send a strong and clear message from the Security Council that attacks targeting hospital and medical workers are unacceptable and will not be tolerated. Demand that all parties to armed conflicts comply fully with their international law obligations, including international humanitarian law. And lastly, urge states to ensure accountability against the perpetration of such crimes targeting healthcare facilities or healthcare personnel exclusively engaged in armed conflict, and request regular reporting by the Secretary General on this issue.
The U.S., whom has continued to violate international humanitarian laws publicly, has served as judge the investigators, Doctors Without Borders president noted.
The U.S., has admitted that it was a breach to international humanitarian law publicly. And so for us, we still reiterate that we find it very difficult that someone will be the perpetrator, the judge, the investigator, and the jury.
Recent statistics have shown that over 350 attacks on some 250 medical facilities in Syria alone has been carried out, with more than 700 medical personnel being killed. Lamin Kante, EYEAFRICA TV.